Vascular disease. Globally, more people die every year from vascular disease than from any other cause. In 2010, there were over 10 million deaths from vascular disease just before age 70 worldwide, and an additional 7 million deaths after age 70. About 60% of vascular deaths are from acute coronary heart disease, what we normally call a heart attack, and 40% are due to stroke. Low and middle income countries are disproportionately affected. Over 80% of vascular disease deaths occur in these countries. Reducing key risk factors such as tobacco use, high blood pressure, bad blood lipids, and obesity can prevent most vascular diseases. Treating those with an early history of vascular disease is also important, what we will call secondary prevention. Let's discuss each of these in turn. Blood pressure is measured as two values, a top one called systolic and a lower one called diastolic. A study done looking at over 1 million adults found that systolic blood pressure of just 20 millimeters of mercury less was big enough to have vascular mortality at ages 35 to 69. The effects were linear at each age range, meaning if you're in your 40s or in your 60s, the effect of higher blood pressure led to higher stroke or heart attack risk. A reduction in blood pressure was particularly effective at reducing stroke deaths, but was also important at reducing deaths from an acute heart attack. Bad blood lipids are also a key risk factor. Randomized clinical trials have shown that drugs called statins can reduce these so-called bad cholesterols or bad lipids. Overall, good statin regimes can reduce the bad cholesterol, called LDL cholesterol, by 2 millimoles per liter. That reduces vascular risk by about 40%. As well, despite what you might have heard recently, taking these statin drugs doesn't lead to any excess in non-vascular deaths such as cancer. Obesity impacts high blood pressure and lipids. Just think about what the effects of body fat are. More body fat increases your blood pressure, bad lipids, and it lowers the good lipids. It also increases the likelihood of diabetes. So each of these factors makes a vascular death more likely. If a person is overweight, reducing their body mass index by 10 units will cut their risk of heart disease or stroke by 50%. Now note that smoking among the obese raises the risks of death even more, so that at every level of higher body mass, obese smokers are at higher risk. Now, if we understand these mechanisms by which obesity raises the risk of vascular disease, you can also understand how secondary treatments work. Long-term drug treatment of statins, simple pills for blood pressure, and aspirin, which thins the blood, decreases the chances of vascular mortality in those that have already shown to have disease. So let's take my case, for example. Suppose that I, as a 50-year-old male, had a previous heart attack or stroke. My risk in the next year of dropping dead or being hospitalized with a heart attack or stroke would be about 7%. If I take an aspirin a day, that risk annually drops to 5%. If I add a simple pill for blood pressure, it drops to 3%, and if I add a statin, it drops to 2%. The order of these drugs does not matter, but what this means is that my 10-year risk of either dropping dead or having another heart attack or stroke, if I've had existing disease, would be 1 in 6, not 1 in 2 if I did not take any pills. So taking pills every day for life can be lifesavers. In fact, for about 20 million people treated with these simple combinations of pills, the world might be able to prevent about 1 million events a year, meaning deaths or hospitalizations. In India, my good friend Dennis Xavier showed that among heart attack survivors, the poorest had the worst death rates after 35 days after hospital discharge. Their rates were much higher than the rich. Now, this shouldn't surprise you. The same finding is seen in the United States. The poor do worse than the rich. But what Dennis showed is that there would be no differences between poor and rich if the poor had access to the same drugs as the rich, and they were able to reduce their risk factors, particularly smoking, comparably. This is very important. There are few things in medicine that can actually remove or nearly eliminate the big differences in mortality between social groups. But here you have a medical therapy treatment that actually could. Treatment plus prevention and smoking cessation. Well, how does one bring about more use of these simple treatments? A surprisingly easy fix is needed, which would involve changing the drug approval process in the most important countries, the big countries, such as in Canada, the US, UK, but also in Brazil and China and India, so that they could help bring combination generic drugs quickly to the market. Right now, these drugs need to be tested when they're put together like they were new drugs, but they can be very much tested like old drugs and brought quickly to market. So the bottom line, the biggest cause of death worldwide are very avoidable vascular deaths. Acting on blood pressure, blood cholesterol, obesity, and most importantly, smoking, paired with simple secondary treatments for those that already have existing disease, could substantially reduce vascular mortality worldwide.